Is this the right one?
Yes.
Okay, great. All right, when you're ready.
Okay, Ashley, I start? Should I start? Yep. Okay, hi everyone. I just want to welcome you here today. My name is Lisa Sikowitz McCall, and I represent Hudson County Community College RN Nursing Program. So welcome everyone. We're just going to do a short presentation on RN nursing. It will be very short and very quick, but my contact name and number is at the end. So the first thing is we accept on a rolling admission basis, so we will continue to accept students until our class fills each year, but the next class is for fall 2022. So our class beginning this year has been filled. The next is fall 2022. Next slide. Thank you. And this is for a registered nurse. So if you're interested in nursing, if you have any interest in taking care of people, if you want to work in a hospital, if you think this is for you, then the RN program, which is registered nurse, is some program you may want to look through for HCCC. Our RN program is for 2 years at the Hudson Community College. Next slide. The most important thing is that it is a application procedure that you will need to do. I think you can hit the next slide and it should come. Yes. The first thing you have to do is submit a nursing program information sheet. It is no fee, and it can be found on the HCC website, or it can be found also at our office with the address will be on the next slide. Go ahead. Yeah, that is our nursing website link. However, it is under construction, so we will be having an updated link. Right now, you could just go to hccc.edu, go on to programs and hit RN nursing. Next. You can pick it up at our nursing office. Our address is Hudson Community College, 870 Bergen, first floor, Jersey City, New Jersey, 07306. Someone is here in the summer, Monday through Thursday, and you may pick up a paper application. You also need to complete a Hudson County application, and the link is there. So 2 applications are necessary. The nursing program is not open admission, so you do have to go through a formal procedure to be accepted. The Hudson County Community College is open admissions as long as you have applied and you have graduated from high school. Next slide. We just added some pictures of our students. This is our students working in our skills lab. Excuse me. Sorry, we have students in the hall there. This is students working in our skills lab and practice lab. When you are a nurse or you're interested in our nursing program, there are skills and physical assessments you will need to do. So this is our students in their uniform beginning ready to practice on our mannequins. Next slide. Requirements for admission, you may hit that. The first is you need to have high school diploma, GED, and you must pass one of our required entrance exams. We do allow students to take any one of those exams. You can take all 3, but the only requirement is passing one of those. So the NLN exam, the SAT, or the ATITs exam. You're welcome to take all of them or any of them. Each of them has a different acceptable score, and it is listed there. These exams generally test your verbal, math, and science skills. We also require that students applying to RN have the high school or college level chemistry, and it must be taken within the last 5 years. We also require a GPA of at least 2.5. We also require 2 references, a criminal background check, drug testing, and students are required to have health insurance. The most important thing that students beginning want to remember is once you apply, you do need to begin to prepare yourself to take one of those exams, and the ones that we require are listed there, the NLN, the SAT, or ATIT's exam. Next slide. Thank you. We're just going to give you a little bit more information about the testing. We require any one of these. Again, the NLN is the National League for Nursing Pre-Admissions exam, and we require at least a 45 percentile. The SAT is through the College Board, and we require at least 480 verbal or 480 math. And we also allow students to take what's called the ATIT's exam, and that's at least 55 on the scoring on that. We did provide you with the links to go on and see about the testing. On those links, there are some small review tests that you can practice on, and it's also a link that you can register if you're ready to take it. Next slide. Again, we have another picture of our students having a group discussion in our practice lab. When you're in nursing, you'll do all types of nursing: medical, surgical, psychiatric, OB, pediatrics, emergency care, critical care. So these students happen to be with the mom and baby in OB and pediatrics. Next slide. Just some general information about our HCC nursing program. We generally get 400 to 500 students applying. We accept about 120 to 130 a year. The overall tuition cost is listed there. That would include all of your college courses and your nursing courses. For the HCC RN program, we do have 3 types of divisions that students can choose from. We have a day division. The general hours are 7 to 2 or 7 to 3. We have an evening division that begins at 5:30 and it will go between 11:30 or midnight. And then the weekend division is strictly, as it is noted, weekend. We have the lecture on Friday evening and the clinical and lab will be Saturday and Sunday. And occasionally you may have to come one additional night during the week for practice lab or testing. But once you decide nursing's for you and you do become accepted, students will need to choose if they want to go day, evening, and weekend, and we do have the availability of all of those divisions. Next slide. We have another picture of our students practicing there. Next one. I won't go through the program curriculum in detail, but you can review this at your leisure. Most importantly for RN nursing, we have college courses, and our program includes 5 nursing courses carried over 2 years. So if you're interested in RN nursing, the total program will probably take you 2 years, and the nursing program and the nursing specific courses will go over a 2-year period. And the non-nursing college courses are listed there. There's 37 college courses and 34 nursing courses. And those are the only courses listed there are what is required for the nursing program. And the bottom portion is the actual nursing specific courses. And the next one. We have some general information that we'd like to provide to students. Once students do become accepted and go through our program, they do have to take a state exam in order to graduate, and in order to practice nursing. It's called the NCLEX. And we are providing you with our national NCLEX pass rate, which is for 2018, 2019, and 2020. That lists the amount of students who passed the state exam and were eligible to practice nursing. And then, of course, the employment rate these days is very high, and I'm sure 99 to 100% of our students get jobs when they come out, and during this time, I'm sure everyone can get a job in nursing, and it would be in various fields, hospitals and healthcare settings, etc. So that's just some statistics about how our program is doing and our graduation rate and NCLEX pass rate. Next slide.
Not sure what happened there. Give me 1 second.
That's okay. We're probably around like slide 13, 12 or 13. Yeah, there we go. And then we just had a picture of our pinning ceremony. When our students graduate in the healthcare field, particularly in nursing, they receive nursing pins, and women do wear nursing caps to celebrate their achievements. That was one of our class graduation pictures for nursing. And next slide. That was a very brief review of what is required for the HCC RN program. Again, we're accepting now for fall 2022. We wish you luck. If this is your chosen career, you may have some interest in nursing or the helping profession. The RN program may be for you. In the next slide will be probably my contact number. So I'm Lisa Siekowitz McCall, Coordinator Admissions and Recruitment Nursing. That's my contact information. Miss Suzette Sampson can also help you. She's the recruitment specialist in the RN nursing program as well. So that's it, a little short review. If you have any questions, contact me or Miss Sampson and we'll be ready to help you. But we are accepting now for fall 2022, and good luck. And if you have any interest, please stop by HCC or the HCC nursing program. So good luck.
Thank you so much, Lisa.
You're welcome.
So next up, we have practical nursing.
Hi, my name is Jerry Kiefer-Necklin. I'm the interim director for the practical nursing program. I'll just briefly discuss our requirements and a little bit about the program. Our program is a certificate program. It is not a degree program, it is a certificate. And in 4 semesters, once you graduate, you meet the requirements to sit for your State Board of Nursing to become a licensed practical nurse. There is a difference between a registered nurse and a licensed practical nurse. And it's a difference in their scope of practice. And our next class starts in spring of 2022. There are requirements prior to becoming a student for the program, and there is an application process and an entrance exam as well. I can put my contact information in the chat if anyone is interested in the practical nursing program, or if anybody has any questions, please let me know. Thank you.
Great, thank you so much, Jerry. We have up next personal fitness, training, and exercise science.
My name is Karen Hosick. I am the coordinator of the exercise science and personal fitness training program. Let me just pull up my slides here really quickly. So we are a fairly new program. We've been around for about 3 years. We graduated our first class of exercise science students last spring. So we're just graduating our next round this spring, and we have graduated 3 classes of personal fitness training students. So first, just here's a little bit of what we do in our lab. We get to play with all types of fun equipment. On the left there, you'll see this year we were doing our social distancing, and we had our plexiglass and our masks on while riding the bike in our lab, and we were practicing taking blood pressure, wearing our face shields and face masks. And these are some from some other previous years, but taking blood pressure, taking EMG activity in the lab, taking blood lactate measurements on a finger using a cool stability balls, doing some plyometrics. And in the corner there is actually our first graduate with the personal fitness training certificate. He passed. So just kind of what we do in our lab there. One of the questions I get a lot is, what can I do with a degree or a certificate in personal fitness training or exercise science? So if you are interested in any sort of exercise, or you played sports and you also like helping people, this is the field, this is the career for you. You can, with a certificate, personal fitness training certificate, or with the associates in exercise science, you can be a personal trainer, you can be a group fitness instructor, you can be a health and wellness coach, you can also be a physical therapy aide. If you're interested in going on for further schooling in exercise science, you can be a strength and conditioning coach, you could be a corporate fitness instructor, a physical educator, a nutritionist or registered dietitian, cardiac rehabilitation specialist. And then if you're like me and you really want to go further and you want to get more, a little bit more schooling after that, you can go on for a graduate degree. You could be a clinical exercise physiologist, could be an athletic trainer, a physical therapist. We have a lot of students right now who are interested in going to school for physical therapy. So they start with their associates with us and then transfer to a four-year university, get their bachelor's in exercise science, and are going on to get their degree in physical therapy. You could be a kinesiologist, a biomechanist, or an orthotist, which they work a lot of times with people who have injuries, or they develop different devices to help people who have chronic conditions, chronic musculoskeletal conditions, to move better. And some people even go on to become a physician or a physician assistant or a chiropractor. So again, that's down the road, but you can certainly start here. So I did mention we have two different programs. So I just want to quickly talk about the difference between our two programs. So we actually have a certificate program, and then we also have an associate's degree program. So we have kind of two. So the first is a personal fitness training certificate program. This is designed to help you become a personal trainer. We use the National Academy of Sports Medicine curriculum, and our students sit for that certification exam. And currently we have a 100% pass rate for our students. This is a nationally recognized exam. And if you go into any gym and you say, I have my NASM certification, they will hire you on the spot. So if that's something you're interested in doing, this is a great place to start. If you come to school full time, meaning you're taking 12 credits in the fall and 15 credits in the spring, you can complete this certificate in 1 year. Some of our students do it part-time, and that's okay too. We also, kind of unique to us, is this includes an internship and test prep course. So with this, not only will we prepare you to sit for the exam, but we also provide you with an internship opportunity. So you get to actually go out to a gym, you get to shadow other personal trainers, you get to work a little bit in the field and kind of pick up some different tips and tricks so that when you do become a personal trainer, you can actually take some of that and put it to good use. The nice thing about our personal fitness training certificate is it can be transitioned into our 2-year associate's degree. So if you're not really sure what you want to do, or you think, I want to be a physical therapist, or maybe I want to, be a strength and conditioning coach, but maybe I should get my personal training certificate first, I would say, yes, do that. And then we can transition you after that first year into the associate's degree in exercise science. So if you wanted to do personal fitness training, the certificate, these are the courses you would need to take. Just want to point out, if you have any thought that you might want to go on for the associate's degree, for the biology course, you would want to take anatomy and physiology, because you'll need that for the exercise science degree. The other courses there is a sequence. You would have to take foundations of personal training, resistance training, and aerobic training before you can take the 200 level classes in the second semester. So just kind of a rundown of how you would take those courses there. For the exercise science degree, many of our students do use this as kind of a starting point to move on to a bachelor's degree. As I said, a lot of our students are interested in physical therapy. We do have some students who are going on for physical education. Some are just majoring in exercise science and want to be clinical exercise physiologists. So there's a lot you can do with your degree, but you can certainly start here. If you know for sure, like I just want to do physical therapy, or I just want to be, work in phys ed, or I just want to be an athletic trainer, and you have no interest in doing personal training, then I would say start with the associates. But again, if you have any interest in doing personal training or getting that certificate, start with the certificate. The reason I say that is because we don't have any sort of internship or exam included in the associate's degree program. So if you're interested in getting that certificate, or if you're interested in doing an internship, start with the personal fitness training. But as I mentioned, this does prepare you to transfer to a four-year institution. And we do have a direct articulation with NJCU, New Jersey City University, right in Jersey City. And all of your credits that you take at Hudson County will transfer into the exercise science major at NJCU. So we actually have a lot of students right now who are at NJCU who graduated last year, and they're loving it. They're loving the facilities over there. So you can transfer all of those credits that you earned at Hudson County and bring them right with you to NJCU. Again, just really quickly run down, this is what the courses would look like. There is some overlap, as you saw, with the personal fitness training and with the exercise science. And we do that on purpose so that you can kind of easily transition if you wanted to do both. I would encourage you though, if you are interested in any of these and you're not sure what classes to register for, you can contact me first. You can get started this summer if you're really interested in exercise science or personal fitness training. Some of the courses that you need, some of those basic courses like anatomy and physiology, are offered during summer session 1 and summer session 2. I will say it's probably hard to get into summer session 1. We actually started yesterday. If you're like really on the ball and motivated and you got in your application and we're ready to jump on it and start class tomorrow, you could maybe do that. But we do offer a lot of those classes during summer session 2. So if you wanted to get a jump start on taking like your anatomy and physiology or your college comp, you could do that during summer session 2. And we're also offering some exercise science specific courses that you would need for both personal fitness training or exercise science during summer session 2 as well. And those courses are resistance training methods and aerobic training. And we're back in the fall, in person, in the lab, doing fun stuff again. So again, if you're interested in a career in fitness or exercise, we'd love to have you. So this is my contact information. Again, I'm the program coordinator and an instructor in the program. It's khosick@hccc.edu. If you have questions about financial aid, I would encourage you to go to the financial aid website. If you're interested in the dual admission with NJCU, because you can also do that, you can enroll in both NJCU and Hudson County at the same time. So you get to use their facilities while you're taking your credits at Hudson County. And if you're ready to apply, you can also do that at hccc.edu/apply. So I will take my information in the chat as well. If anyone has any questions, I'm happy to answer them. Please feel free.
Awesome. Thank you so much, Karen. Our next presenter is going to be the Radiography Department. And let me just queue up your presentation. Can everyone see my screen?
Hi, everyone. Can everyone hear me? My name is Kathy. I am the admin at the radiography program here at Hudson County Community College. So I'm just going to discuss with you our great program and what you would need to do to enroll. Next slide, please.
Strange, it's not letting me advance the slides. Give me 1 second.
Okay, while she's working on that, I'll just give you a little bit of a rundown. We are a 2-year daytime only program. You would need to complete certain prerequisites before you can be considered to start our program. There they are.
There we go.
So I'm Kathy Rodriguez, the administrative assistant. There are the list of our other people in our department. Ms. Cashel is our program director, and we have teaching faculties and clinical faculty members. Next slide. As I stated before, we are a 2-year, 24-month program, Monday through Friday, daytime only, which means 7:30 in the morning until 3 o'clock in the afternoon, every day for 2 years. Class is limited to about 18 students and admission is very competitive. There's a minimum of a 2.5 GPA that you must have and a entrance exam, which is either the T's and or the SATs. There's a criminal background check that we do as well as drug screening. Next slide. The top portion of this slide right here shows the 33 prerequisites that you must complete prior to being considered for our program. So all those 33 credits must be completed first. We start our program in August, September of every year. Next slide. So I stated before, those general education courses total 33 credits. Once you've completed our radiography courses, that's an additional 30 credits for a 63 credit degree in associates in science. Daytime only, 5 days a week. The first year you're in the class on Monday, Wednesdays, and Fridays, and you're in clinical Tuesdays and Thursdays. Your second year, it just reverses. Now you're in classes on Tuesdays and Thursdays, and in clinical on Monday, Wednesdays, and Fridays. One important thing to also note is that all our courses are held only in the Journal Square campus. Next slide, please. Currently, our students are rotating through 4 clinical sites: Hoboken Medical Center, Bayonne Medical Center, Christ Hospital, and even one in Staten Island, New York. Students are responsible for finding their own transportations to these clinical sites on time, which, as you recall, 7:30 till 3. And you don't really get to choose which site you want to go to. We just rotate our students equally throughout the 2 years they are in the program. Next slide. A rough estimate amount is about $20,245 for just the radiography portion of the program. That $20,000 is the 2-year total, approximately. Next slide. We will begin accepting applications November 1st of 2021, and we'll accept right through March of 2022. We'll start accepting in November if you want to be considered for the program in August. The application deadline will be March 25th, 2022. So you can plan for your applications starting November. Next slide, please. Keep in mind that a minimum of a C grade in all your prerequisites is the minimum that we will accept. All your science courses must also have a C and cannot be older than 5 years. Next slide. If you guys have any more information, you can reach me here at my email address. You can reach out to Kathy Wennings as well with the Health Sciences program. And thank you for having me. And I'm excited to see you guys. Talk to you soon. Thank you.
Awesome, thanks, Kathy. Okay, next up, we have the public health program.
Ashley, do you have those slides or do you want me to share the screen?
You can go ahead and share the screen. I can't seem to find that
That's okay.
previous presentation yet.
I got it. Let me go here, share the screen. Okay, there we go. It's coming. Share. There we are. Okay, and let's make it look a little bit nicer if it'll do it. There we go. All right. I am Kathy Smith-Wenning. I am the Director of Health Programs at Hudson. So under my watch, I assist with the paramedic program, EMT. I help out Professor Hosick in exercise science and personal fitness training. And I'm a resource to the medical assisting program and to the radiography program and to the practical nursing. Professor Kiefer is the director of the practical nursing program, but I'm also in my office most days of the week. So I'm always there in order to help you with your questions. So we started this new degree at Hudson. It was in progress prior to the pandemic, and it's the public health degree. It's part of the health services degree. And what I really like about the public health degree is that it gets you ready for whatever you want to do in the future. So if you're not that sure that you want to touch someone, that even though you like nursing and you like health, or maybe you kind of like the personal fitness training, but touching people isn't your thing yet, the public health degree is a great place to start. It is a launch to other areas of health science. We too, with the public health degree, we have it's called an articulation agreement, similar to the exercise science with New Jersey City University. And what that means, as Professor Hosick said, is that if you're in the articulation agreement, you can use you'll be enrolled at HCCC and NJCU at the same time, and it would be a seamless transfer once you're done with HCCC. So what can you study? So we study in public health. We do study infectious disease. We look at disease transmission. We do look at vaccines. The COVID vaccine is not the only vaccine out there. We look at chronic diseases such as diabetes, heart disease, sickle cell, and also sickle cell anemia and the prevention and treatment. Now, while diabetes and heart disease are chronic diseases, they're often called more of a lifestyle disease. Sickle cell anemia is not a lifestyle disease. That's a genetic ailment. There's no prevention for that, but there is treatment. So it's important for public health professionals to understand the difference between a chronic disease that you can manage with diet and lifestyle versus a chronic disease that's genetic. So that's an example of lifestyle versus genetics. You could just be an environmentalist. You want to know about clean water, clean air. You also want to reduce tobacco pollution. In other words, indoor air quality, outdoor air quality. Then we have occupational safety, such as motor vehicle safety, or you could work for OSHA, which is a federal agency which helps mandate safety precautions in the workplace. Or maybe you're interested in family health. We look at infant and maternal morbidity and mortality. And what that means is we look at the health of babies and mothers. How healthy are they? How sick are they? And if they die, why do they die? We talked about the articulation agreement and the dual admission. So easy transfer, and you would be a student in both places. So quickly over to the requirements. My God, the red jumps right out at you. The general education is somewhat similar in just about all of these degrees. English Comp 1 and 2, some type of math, some type of computers. In this degree, it's only one semester of human biology, a little bit of psych, some diversity electives, and some social science. Now let's go over to the public health. I wrote the program, and I also teach some of the courses and wrote some of these courses. One of my favorites is global health. That will probably be offered in the fall or maybe the spring. It's a brand new program just starting in September. We can look at healthcare, or how healthy or sick people are across the world. And remember, look where we're at. People migrate to the United States through New Jersey, through New York, and they bring their health issues with them. So an understanding of global health helps you understand the patient population of the people you'll be working with. Consumer health, some more physiology, pathophysiology, which is diseases, right? Environmental health, an absolutely wonderful disease. Healthcare navigation can teach you, give you a skill set. So maybe you can work at a clinic or a doctor's office and be upfront and assist the professionals in where the patients go next. One of the courses I wrote, Health Disparities. This is a topic that has truly come up with the pandemic. Why do some populations or groups of people do much better than others? It's important to understand this if you work with people and you're in charge of their health. My favorite course, Culture, Diversity, and Healthcare. I'm also a medical anthropologist, so I study cross-cultural health practices and beliefs. So this is kind of like my baby course. We're running it this summer. It's offered face-to-face and it's offered online. Then we have an introduction to the healthcare environment and a service learning internship, which will really launch you and get you some face-to-face contact with some of the agencies we work with. And that's it. Who knew? And I will stop sharing. And when we get back, we can answer some questions. But I think we have medical assisting coming up, do we not, Ashley?
Yes, we absolutely do. So I'm going to turn it over to Jihan now.
Hello, everybody. So so happy to be with you today and welcome in the medical assistant program. I am Jihan Nakla. I am the medical assistant instructor and responsible for the practicum coordination in our program. And let's discuss it together. What is the medical assistant and what do they do? I know you have a bunch of information today, maybe a lot, but we are trying to give you many opportunities so you can start your career. Let me share with you my presentation. So are you able to see it?
Nope.
Not yet. Did you hit share screen? And you know how to do this. You've been doing this for a whole year now.
I know. Yeah. Yep.
There we go.
Yep. All right. So start to talking about what do you mean by the medical assistant. So actually medical assistant, they have something a little bit unique. Why? You can see that you can see medical assistant whenever you go to the medical office. They are the first person you will encounter, and they will receive you. They will welcome you to the place. They will help you, assist you how to schedule your appointment, how to just contact or how to be referred to another doctor. They will help you in many different steps dealing with the insurance. So they will be very helpful. In addition, as a medical assistant, you need to acquire or build up what we call the soft skills. What are they? This is the communication skills. So you will be the person who is in just direct contact with the patient, explaining to them what are the test results, explaining to them how to take their medication. And trust me, if they trust you, they will follow whatever you're saying, just like ABC. And this will be good for your patient. Something very interesting also, so you have like dual action or task. So we will see in here the medical assistant in the office, they have do administrative jobs or tasks in addition to clinical tasks. So what do you mean by administration? You are the person who schedule, as I said, schedule the appointment for patient. Maybe you will be helping the patient. They don't know how to check their insurance, how to do any of the paperwork. So you are the person who is helping. Also, you will be helping in the billing and bookkeeping, and this is key point in your job. If you are good in that, so you will be very helpful in your office. Well, what about the clinical duties? Most of our students are very interested in hands-on, and these are some pictures. You are able to see they are taking their vitals in the form of the pulse, blood pressure, temperature, and we can go further to do like EKGs. So we have like classes, they are taking EKGs, and we are learning our student how to do it perfectly in order to get good results. Also in here, you can draw blood, but in order to draw blood, you have to be certified phlebotomist or certified medical assistant in order to be able to draw blood. In addition to many other simple procedures that you will be able to do in the medical office. Well, one of the most common or frequently asked question, why do I have to be a medical assistant right now? after this pandemic, so the role of the medical assistant, it's brought a great or no attention to the importance of the healthcare worker in the society. And there is high demand right now for medical assistant. Trust me, every now and then I receive many requests. They are asking to hire medical assistant in different positions. I received from the RWJ Barnabas Medical Group. I received from Inglewood Medical Group. And we are right now sending our students to the North Hudson Corporation for externship, and they are hired there. So there are great opportunities in order to start your career. So something very unique about the medical assisting I wanted to share with you. You are able to be a medical assistant, and it could be a standalone career, or you can just, if you are looking forward further to get into another step like nursing, if you are looking forward to go to switch to another profession like radiography, like anything, you will be able to do that. Very simple, very easy. And you are able to switch your major, or you can upgrade it. I have many of my students, they started as medical assistant, and then after they are done and they graduate, they apply for nursing. And I have like 2 of them starting this semester in August or September. So they started the program in our college in Hudson. So this is very interesting, and also is very promising, because sometimes you feel like you stuck with the life struggle and you're unable to proceed. So it's better to have a degree, start working, get a job, and help your family instead of waiting and just waiting to do anything, or waiting to pursue your nursing. But right now it will be better to have your degree and then upgrade it to another level. Well, now I understand what is the medical assistant and what is the demand. Let me know, how long does it take to be a medical assistant? Okay, so as you all just hear from my colleagues, so we have like 24-month clinical competency-based educational program. So you need to spend with us like 4 semesters. These 4 semesters, you have the classes, they are offered, some of them during the day and some of them in the evening. Why? To make it flexible with your work schedule if you are working. The class size, it will be just within 25 students. Once you're done with these 4 semesters, you will be ready to have your externship in the clinical side in order to gain more practice and more exposure to the actual field. In addition, you will be eligible to sit for your certification exam. Currently, it is CCMA exam. It is offered by the NHA. So you will be able to take it through our college, and I'll be helping you in order to review and to make sure that you will pass. Well, how to start? Okay, very simple. We are open enrollment in institutions. So once you have your high school diploma or GED, and once you have the college placement test, exit academic foundation, you're ready to go. You will be able to apply. And then you will start your gen ed. What do we mean by gen ed? These are the general education courses. As Professor Hazek said, yes, these are the courses. They can be offered during the summer. They are offered in fall and spring as well. So these courses, you can start taking them. Once you're done with them, you are ready to go to the next step, which are the main core curriculum for medical assistant. So these are the classes that if you follow our recommendation, you can finish them all in kind of 2 semesters, maybe 3 by maximum. So after you're done, you have to finish your externship in the clinical side and you're ready to go. Okay. I want just to share with you, sorry, this is I'm not sure if you are able to see it all. So this is the first semester, the second, the third, and the fourth, and these are all for 60 credits. Once you start to think about the medical assistant, I would recommend please contact any of us in the division. I will give you our information, contact information, so any of us will be able to help and guide you, because sometimes it will be easier to follow the sequence of these courses to finish in a timely manner. So it will be very helpful and you will be able to get whatever you need. This is the externship. What do you mean by externship? This is where to go for the clinical sites in order to start to encounter patient. You will practice and you will be under the supervision of one of the clinical site supervisor. You have to spend like 200 hours so far till now, 200 hours, in addition to 15 hours you're gonna spend with me in the college. Okay. These are some requirements once you are thinking about once you are thinking to start the clinical courses or the externship, you will be asked to have your clinical insurance, liability insurance, and this is the criminal background check. While you are taking our courses, you will be trained on the CPR, BLS, which is like cardiopulmonary resuscitation, and you have your certificate after you're done. All right. These are our contact information. So this is Dr. Sarhan Abdullah. He's the coordinator, and this is his phone number. This is my name, Jihan Nakla, and this is my email, and this is my phone number, and this is Miss Tess Wiggins, and she will be able to assist you. She is the admin, and also we have the Professor Winning. She is the director of the health-related program, so she will be, as she said, she is always available. She made herself available anytime to help any of you. Okay, so just I wanted to share with you in a quick in here, if you have any question, this is very common question. Can I switch to medical assistant from another major, or can I go from medical assistant to another? Yes, you can. So I have like a couple of semesters ago, I have one of my student, he was planning to go to physician assistant. I was like, oh, wow, yes, and he did it. Now he applied and I just gave him recommendation letter. He's very good and he was accepted. And another common question in here, can I sit for the certification exam before having my externship? The answer is yes. The most important to just complete all of the courses before you sit for the certification exam. By the way, I have like some of the students, they sit for the certification exam before they start their externship, and once they are done with the externship, they were hired right away because the certified medical assistant, they are highly in demand. Another question in here, very, very common. Can I start my externship before I finish my courses? The answer is no. You have to complete all of the courses and then you will be able to, or you will be eligible to start your externship. So I wish you all the best of luck, and I'm so happy to be with you today. Whenever you feel like, yes, you want to do this medical assistant or any of our programs, feel free to reach out to any of us. We will be more than happy to help and assist you. I will leave you here my contact information just in case if you want to ask about anything, I will be there. Thank you.